Julie Sharp, and I am your EAP account representative for the Employee Assistance Program for Bobby Dodd, and have been for, I think, since around 2010. So I want to say good morning to everybody. I wish I could join you live today, but I'm happy to join you via this recorded message. I want to thank you for spending a few minutes with me thinking about mental health awareness and why it's important and what each of us can do to help stop the stigma that sometimes exists around this area. I also want to overview your EAP services, remind you of what's available to you, and also introduce some new resources around mental health awareness. So you might ask, why mental health awareness? Why do we focus on mental health awareness in May every year? Well, the short answer is we want to normalize and bring awareness to this issue so that all of us are better equipped to look after our own mental health, as well as to empower people who may be struggling, which is all of us at some point. Of course, this is a huge, wide-ranging conversation, many important points of which we will not be able to address in our short time together. It's also an evolving conversation as our understanding about mental health continues to grow. We know that the pandemic exacerbated the occurrence and intensity of mental health struggles, but it's also brought this issue to the forefront in a way that it hasn't been before. Gen Z leads the way in normalizing this conversation and helping to reduce the stigma around this issue. TikTok and other social media platforms share a lot of information on this, sometimes misinformation to a wide audience, but overall I think this is really a hopeful trend to get the information out there to help normalize and stimulate conversations. So the good news is there are reasons to be optimistic about the future of mental health and well-being. Still, the reality is that we're not there yet. Stigma around mental health is still with us, and observances like Mental Health Awareness Month offer another opportunity to bring awareness, to educate, to understand what we can do as individuals to move the conversation forward in a way that connects and benefits all of us collectively. So let's start with just a few numbers to give us a picture of what we're talking about here. Thought you might be interested in seeing some of the themes or clinical reasons that people call into our intake center seeking support. You can see here some of the more intensive things, grief, which is something we all go through, workplace conflict, relationship issues, bereaved parents, parents dealing with the suicidal ideation of a child. We had like 4 calls in 1 week at the end of March, I believe, which was a bit unusual, but concerning nonetheless. So we know that people are going through a lot of difficult things, and yet we know that somehow stigma persists in the workplace. So how might stigma show up in the workplace? We know that because of stigma, people who experience mental ill health may be labeled by others and seen as their condition, not as a person with a condition. They may be expected to get over it and change their thoughts and behaviors just on command. They may be seen as erratic or even dangerous, blamed for their conditions, or ostracized, especially in the workplace. Surveys of U.S. employers show that half of them are reluctant to hire someone with past psychiatric history or currently undergoing treatment for depression. Approximately 70% are reluctant to hire someone with a history of substance abuse or someone currently taking antipsychotic medication. Employers are more likely to hire someone with a physical disability. So some facts about mental health. Many people feel very uncomfortable talking about mental health, but hopefully that is improving with some of the things I mentioned, like the access to information through TikTok and some of the other social media platforms. But people with mental ill health can be stereotyped and discriminated against. By ridiculing or labeling someone, we create a barrier that makes us think we're not like that person. I think anytime that you create an us and them dichotomy, that is problematic in many areas and context. So I think that's always a cautionary thing that we want to pay attention to when we notice an us and them dynamic. We're frightened of mental illness in a way that we're not about physical illness, and we want to believe that could never be me. For some people, the impact of stigma is worse than the symptoms of their mental health condition. We know that people's recovery can be held back by the barriers that stigma creates, often through problems encountered at work. Stigma may make people reluctant to admit that they are struggling with mental health difficulties, and this can delay their treatment and support. So to reduce stigma and discrimination, we need better education and awareness around these things to help reduce the stigma and, so bust some of the myths that are out there about this. So what are some things that we can do as individuals to reduce stigma and support mental health and well-being in the workplace? Well, one thing you can do is to watch your language. Many times we use words mindlessly without realizing the impact they may have on others. So by educating ourselves and making some adjustments in the words that we use, we increase awareness and help reduce the stigma around mental health. The Mental Health Coalition created a language guide. Let's talk about it to help us with that process. So in addition to adjusting our language, another thing that we can do is to pay attention. Pay attention to what is going on around you and to how your colleagues are doing. EAP focuses on early intervention, or as I like to think of it, upstream intervention. We want people to get connected to resources and support that they need to be resilient and come through difficult times so that a more intensive intervention is not needed later as the issue is allowed to progress. So as the water flows downstream and picks up speed, the intervention becomes more difficult, costly, and complicated the further down the stream one goes. So when someone fails to get support early on, it doesn't just affect them. It also affects their colleagues as well as their family and friends. And in extreme cases, it can also cause liability or reputation issues for the organization. So upstream intervention is essential. And to do that, we need to recognize the signs that our colleague is struggling so that we can reach out with our concern and point them to resources that will help move them to a healthier place. And I would also say here that self-awareness is important, recognizing these signs in yourself and getting the support that you need early on so that you can come through things in a healthier, happier place. I know it's hard to see this sometimes in ourselves. It's easier to see it in others than it is ourselves. But hopefully this will help you with that process. It's also important, of course, to be open to input from others. If someone approaches you, to be open to that. So let's think specifically about what specifically are some behavioral health signs that we should be paying attention to. So some signs of stress or mental ill health include things like an increase in unexplained absences or sick leave, poor performance or timekeeping, and increased use of alcohol or drugs, frequent headaches and backaches, withdrawal from social contact, isolation, increased conflict with colleagues or family members, poor judgment or indecision, constant tiredness, or unusual displays of emotion. Also, working more slowly, missing deadlines, having difficulty concentrating, appearing numb, withdrawing from work activity, that isolation again, overworking, forgetfulness, and having difficulty with work transitions or changes in routines. Signs of substance misuse include absenteeism. So a pattern of if someone is, leaving early on Friday or calling out on Mondays, that's a pattern that you should pay attention to. If there's been a decrease in the quality and quantity of work, or neglect of appearance and personal hygiene, sleep or appetite issues, inappropriate responses, again, increased difficulty getting along with people or isolating from families, friends, and colleagues, a lack of focus, or even an exaggerated sense of well-being. So what do you notice about these signs? For the most part, they are observable behaviors that show up in the workplace, not psychological symptoms. So here is a guideline that you can use that will let you know maybe when something needs to be addressed. If you notice patterns or clusters of behaviors, not one thing in isolation, but patterns or clusters of behaviors over a period of time, typically 3 to 6 months, that's a departure from the person's usual way of being. That tells you that there's something going on and the person probably needs some support. For example, if you have someone on your team that's been, a top producer or, an exemplary employee, and then suddenly they're not producing, or they're not meeting deadlines, or they're no calling and no showing. Or if you have an easygoing employee who suddenly can't get along with anyone, or a gregarious colleague who is suddenly you've noticed becoming withdrawn and isolated. So again, those patterns or clusters of behavior over a period of time that is a departure from the person's usual way of being. So we want to pay attention to these things and notice these changes. They can happen kind of in a subtle manner. They're not always obvious unless we're paying attention. And we want to ask the person, by calling attention to what you're seeing that they are saying and doing. So I've noticed that you have been, not yourself lately. You've, been out a lot, or you're having trouble, you've been more irritable or whatever. And just say, I'm concerned about you. And I just wonder if you're okay. And then listen to what they had to say. That goes a long way in itself to helping people feel connected and supported. Refer to resources. So we need to be aware of the EAP and how to use the EAP. So use those resources and encourage others to do so as well. Seek consultation when needed and take appropriate action. We don't want to ignore or delay taking action. If it has come to on your radar that someone is having difficulty, they are pretty far down the road, probably. So they're going to need some support. This is not something that they're just going to snap out of. So we want to make sure that we extend that to them. We don't want to offer pat answers or advice or try to solve the problem alone. We don't want to take on the role of a counselor and try to diagnose them with a mental health condition. We just want to let them know that we see them, that we care, and we can direct them to resources. So we can adjust our language, we can pay attention to people, express our concern, offer resources. And what else can you do? You can learn about mental health, educate yourself and others, which is what we're doing here today. You can be aware of your own negative stereotypes and stigmatizing attitudes, and make sure that we are seeing the person and not the illness, and that we, face our fears that happen, that cause us to, create us and them dichotomies. We can tell your own story. All of us have a story. We've all gone through difficult times at one time or another. And by telling our story, we again create that connection and provide encouragement for people to seek their own support. And again, take action by spreading the word and raising awareness. And in doing this, we can make a difference for everybody. So let's overview your EAP services. I want to make sure that you are reminded of the kinds of benefits that are available to you through the EAP. So we'll start out with a short member orientation.
Life is full of ups and downs, challenges and triumphs, and everyone could use a little help sometimes. That's where this assistance program comes in. Members receive high-quality, personalized care, which includes mental health sessions for help with interpersonal struggles, emotional issues, stress, anxiety, depression, and substance misuse. We can also assist with medical advocacy, life coaching, and legal and financial consultation. Work-life referrals and personal assistant also cover childcare, elder care, pet care, home repair, transportation, and travel. Our member portal and app additionally provide thousands of articles, videos, and worksheets, legal and financial tools, self-care and healthy living, a discount marketplace, and more. All of these comprehensive assistance programs benefits are confidential, accessible 24/7, and open to all family and household members. Members have a wide range of access options and can contact their assistance program by phone, text message, email, or the web portal and mobile app. Contact us anytime. We are here to help.
I wanted to say just a little bit about the 988 number, which you may be familiar with. This replaces the suicide hotline. It's been in the works for many years, and it was finally launched last year. So it's still a work in progress, but it is in operation. And the 988 number is specifically intended for suicidal, substance use, or mental health crisis. And in most cases, the call itself is the intervention. So people can call this number and be provided support in the moment. Only about 2% of calls are necessary to coordinate with 911. If there's some kind of imminent threat to life, then the 988 can loop in 911. But in the most cases, the call itself is the intervention. Then they will also provide linkage to support resources, follow-up if needed. And one thing I really like about this as well is that you don't have to be the person in crisis to make this call. If you're concerned about someone else, you can call this number and talk with a trained mental health provider to get some guidance and support on how you can, support the person that you're concerned about. I want to thank you again for joining me today. I hope you've gained something that you can use to support your own well-being as well as that of your colleagues. Have a great afternoon.